Oxygen delivery devices are a critical NCLEX topic. Nurses must master the specific oxygen percentages and clinical indications for each system. Questions often test your ability to match the right device to a patient's condition. Let us break down the 4 essential tools. We will explore the nasal cannula, the simple face mask, the non-rebreather mask, and the precise Venturi mask in detail. The key is understanding the balance between low-flow support, emergency high-concentration needs, and the requirement for precise oxygen control. First, the nasal cannula is the most common device. It delivers low-flow oxygen through 2 small soft prongs placed inside the nostrils. It provides an oxygen concentration of 24 to 44%. This is achieved with flow rates between 1 and 6 liters per minute. Patients typically tolerate the cannula well because it is lightweight and comfortable for long-term use in a clinical setting. Crucially, this device allows the patient to eat, drink, and speak without significant obstruction, improving their overall comfort levels. It is the standard choice for patients experiencing mild respiratory distress or those with low oxygen saturation levels needing support. On the NCLEX, keep in mind that increasing the liter flow increases the concentration, but keep it within the safe range. Be aware that flow rates exceeding 6 liters per minute can dry out the nasal passages, causing discomfort for the patient. Next, we move to the simple face mask. This device delivers a higher concentration of oxygen compared to the nasal cannula. It provides roughly 40 to 60% oxygen. To achieve this, you must set the flow rate between 5 and 10 liters. A vital NCLEX point: never set the flow below 5 liters per minute. Doing so risks the patient rebreathing their own carbon dioxide. This mask is ideal for patients who require moderate oxygen support but are not yet in a state of severe respiratory failure. Now, consider the non-rebreather mask. This device delivers the highest oxygen concentration possible without resorting to intubation or mechanical ventilation. It can provide up to 100% oxygen. This is achieved with high flow rates ranging from 10 to 15 liters per minute. The mask features a reservoir bag that must remain partially inflated at all times to ensure the patient receives the intended flow. If you notice the bag collapsing completely during inhalation, the oxygen flow is insufficient and must be adjusted immediately for safety. Non-rebreather masks are reserved for emergencies. Think of trauma, shock, or severe hypoxia, where the patient is critically unstable. When you see an NCLEX question about a patient needing immediate, high-concentration oxygen to survive, this is your primary answer. Finally, we have the Venturi mask. This device is unique because it delivers a very precise, controlled oxygen concentration to the patient. It can provide oxygen levels ranging from 24 to 50%, depending on the specific adapter or setting used by the nurse. This precision is especially important for patients with COPD. These individuals are often sensitive to excessive oxygen levels in their blood. The Venturi mask allows nurses to carefully regulate oxygen delivery, which helps prevent the suppression of the patient's natural respiratory drive. If an NCLEX question mentions COPD, combined with the need for precise oxygen control, the Venturi mask is the correct choice. Let us review some memory tips. Think of the nasal cannula as your low-flow, comfortable option for mild respiratory support. The simple face mask is your go-to for moderate oxygen needs. Always remember the 5-liter minimum rule to avoid carbon dioxide buildup. The non-rebreather mask is for emergencies. It provides the highest concentration for patients who are critically unstable or in shock. The Venturi mask is for precision. It is the gold standard for COPD patients who require careful, specific oxygen delivery levels. Another helpful NCLEX clue is that unstable patients almost always require higher oxygen delivery devices to maintain their vital signs. Understanding these devices is essential for both passing your exams and providing safe, effective care in a real clinical environment. Nurses must be able to recognize the clinical presentation of a patient and select the device that matches their specific oxygen requirements. The nasal cannula is for mild support, the simple mask for moderate needs, the non-rebreather for emergencies, and the Venturi for precision. The more you practice connecting a patient's specific respiratory condition with the correct oxygen device, the easier these questions become. Mastering these concepts now will build your confidence for the NCLEX and prepare you for success in your future nursing practice.